So the question is, a 48-year-old smoker presents to the OPD with the complaints of cramping pain in both the calves on walking to about 100 to 150 meters. So there is a fixed distance. The pain is relieved on taking rest for about 2 to 3 minutes, and the patient is able to walk for some more distance again before the pain reappears. So this presentation is suggestive of. Intermittent claudication. So the answer is intermittent claudication. Why? Because clues like it is in the smoker, cramping pain is in the calves, there is a pain occurring after a fixed distance, then pain relieved by rest for about 2 to 3 minutes, and then the patient can walk again, and then pain reoccur. So this is in the intermittent claudication. So what is intermittent claudication? This is a peripheral arterial disease in which exercising muscles more demand for oxygen, but stenosed arteries cannot supply sufficient blood. So there will be pain. Now the thing is, why there is a calf pain? So on the basis of where the site of disease is, the pain will occur accordingly. So if the obstruction is in autoiliac region, the claudication will be in both buttocks, thighs and calves. If the obstruction is in iliac region, there will be unilateral claudication in thighs and calves. If there is a femoropopliteal obstruction, there will be pain in the case of the calf region. And if there is a distal obstruction, the claudication will be in the calf and foot. So in the autoiliac obstruction, there will be buttocks, thighs and calves. Then in the iliac, there will be only thighs and calves, sometimes in the buttocks. In femoropopliteal, will be only in the calf. In the distal obstruction, will be calf and foot. So the site of the pain can help in localization of where the disease is. Now, why other options are wrong? So if it is the muscle fatigue occur after excessive exertion, not after 100 to 150 meter. It is not associated with a fixed walking distance. It is not rapidly relieved, as it has occurred here in this case, for after 2 to 3 minutes of rest, not rapidly relieved. So the muscle fatigue will not be the correct option, so it will be incorrect. Osteoarthritis of the knee will involve the knee joint pain, with the knee pain, not calf pain, and it will be associated with movement, and not relieved within minutes of rest. So just starting the movement, there will be pain. So B is also wrong. Coming to the fourth option, neurogenic claudication. So in the neurogenic claudication, the pain worsen with standing or walking. Even with standing, there will be pain, and walking. And in this case, the relief will occur on bending forward, not by taking rest, or by bending forward, which is also known as shopping cart sign. In this, the walking uphill will be easier So when the patient will be going on the slope, it will be easier. So walking uphill will be easier, or go on the staircases it will be easier. Relief taking takes longer. Relief takes longer. So that's why the fourth option will again be wrong. So correct answer will be the C, intermittent claudication. One more thing in the case of the peripheral arterial disease is ankle brachial pressure index. So we should know ankle brachial pressure index because we have to do this as investigation. So in the ankle brachial pressure index, if the value is, the normal value is about 1. If the value is less than 0.9, it indicates arterial obstruction or claudication. So in this case, which is given, the ankle brachial pressure index will be less than 0.9. If the value is less than 0.5, there will be rest pain. And if the value is less than 0.3, it indicates there will be imminent necrosis. So this is also asked that when there will be imminent necrosis. So imminent necrosis will occur when it will be less than 0.5. When will rest pain occur? When it will be less than 0.5. And when will claudication occur? It will be when the ankle brachial pressure index will be less than 0.9.